Good morning, or sorry, good afternoon. We're going to be starting in just a couple of more minutes. I think we're approaching 2 o'clock. We'll just wait for one or two other individuals, and then we'll get started. But thanks for joining us. Just we'll wait, and we'll be back on in a couple of minutes. Hey everyone, welcome to this week's all staff, or sorry, welcome to this week's COVID media information session hosted by the Haliburton Kawartha Pine Ridge District Health Unit. Thank you for joining us. My name is Bill Ekoff, and I'm the communications officer with the health unit. I'm going to just ask people to keep their cameras and mics off for now. The session will be available as a recording afterwards on our YouTube channel. We are pleased, as always, to have Medical Officer of Health, Dr. Natalie Bocking, join us. She has a lot to update. It's been a while since our last info session. She will be making some opening remarks, after which we'll open it up to questions from the media. So I see we've just got a couple of others joining us. So without further ado, I will turn it over to Dr. Bocking.
Great. Thanks very much for the introduction, Bill. Just confirming you can hear me okay.
Yes, we can.
Okay, wonderful. Well, welcome everybody to our media information session. As Bill mentioned, it's been a couple of weeks since our last session, and so as much as we had hoped that there wouldn't be a lot to update on, or wouldn't be a lot of COVID activity, as usual, we're always surprised by the next turn in this pandemic. As Bill mentioned, my name is Natalie Bocking. I'm the Medical Officer of Health with Haliburton Kawartha Pine Ridge District Health Unit, and happy to provide these updates today, and we'll answer questions to the best of my knowledge. So I'll start with an update just on general COVID-19 activity or transmission. Have a couple of updates related to COVID-19 vaccination, and then a couple of other helpful summer reminders for other public health topics. So related to COVID-19 activity, as I'm sure you're all aware, on July 6th, the Chief Medical Officer of Health for Ontario did announce that Ontario is in the 7th wave of the COVID-19 pandemic, or also can be referred to as the 3rd Omicron wave. This wave is being driven by the Omicron subvariant, BA.5. BA.4 and 5 first really emerged out of South Africa and then started to be seen in other countries. Similar to how it's worked in previous waves, you essentially have a new variant or subvariant that is more infectious than the previous one. And so it slowly pushes out the previous variant or subvariant to become the dominant variant. In Ontario and Canada-wide at this point in time, BA.5 is the dominant variant that we're seeing in all of our whole genome sequencing surveillance work. We know that BA.5 is more transmissible or more infectious than the previous Omicron variants, as well as the previous variants prior to Omicron. We also know that the risk of reinfection is higher. So if you had COVID-19 from Omicron, either BA.1 or BA.2, or you had COVID-19 from another variant, you can still get BA.5. So the risk of reinfection is there. We know that the vaccines still provide good protection against serious illness from COVID-19 with the BA.5 variant, certainly from what we've seen in other jurisdictions. And it does seem that the BA.5 variant does not cause more severe disease. So similar severity of disease to other Omicron variants that we've seen for the last 2 waves. Now, I think it's important to remind everybody, and it might sound like a broken record because we said this with the last wave and the wave before, that even though the Omicron variant and subvariants, including BA.5, don't cause as severe disease as the earlier variants, because it is so much more infectious, the absolute number of people that might become seriously ill requiring hospital admission may be larger than what we've seen. We hope, and I think the plan and the assumption right now is that the 7th wave will not be as severe or not cause the same number of hospital admissions as the 6th wave or the 5th wave. Those assumptions are primarily based on the amount of immunity we know we have among the community, whether it's by some more recent natural infection plus vaccination, which does provide some good, robust protection against serious illness, and the fact that it's summertime and people hopefully are not gathering in as large numbers indoors, which puts the risk of transmission or spread of COVID-19 higher. So we should expect, certainly locally over the next couple of weeks, to see an increase in activity, including in hospital admissions, but hopefully not as significant as what we saw with the last wave. That being said, I think it's also important to be aware that our hospital system is already under tremendous strain due to a number of factors, including shortages in nursing physician and other allied health staff. So really any increased burden on the healthcare system contributes to that strain and puts pressure on the system overall. So as much as we can avoid really any strain on the healthcare system, we want to be doing that. When we look at the spread of BA.5 provincially, so we know that provincially all of the indicators have been increasing. There has been an increase in the number of new lab confirmed cases, increased in wastewater viral signal throughout many areas in the province, an increase in the number of outbreaks, and an increase also in the number of hospital admissions being noted provincially. This is not being felt equally across the province at this point in time. Our colleagues in Eastern Ontario, and in particular Ottawa, are experiencing a more rapid increase in case activity, with test positivity approaching 20%. Locally here in Haliburton Kawartha Pine Ridge District Health Unit, we are just seeing very early small increases in the indicators that we typically follow. We have seen a very small uptick in wastewater viral signal in both Lindsay and Cobourg, but very, very small, nowhere near where it was in the last wave. A reminder that the wastewater surveillance data that we receive here has about a 5 to 7 day lag period. So we're always a little bit behind with the data we have from wastewater surveillance. Our test positivity is increasing. We had gotten to a number as low as 2%, and we've inched back up to around 9% for our test positivity. To put this in perspective, our test positivity increased to about 22, 23% at its highest level in the first Omicron wave back in January. We have had a small increase in the number of outbreaks attributed to COVID-19 and are currently managing or supporting 4 outbreaks. Again, to put this in perspective, at the peak of the last wave, we were managing 23 outbreaks at its most intense point. We have not seen a significant change in the number of hospital admissions we're seeing. We are still and have continued to see a steady trickle of new hospital admissions from COVID-19. As I understand it, there are currently 4 individuals that are residents of HKPR admitted to hospital. So we are still seeing some severe illness, and this may increase over the next couple of weeks as we see a bit of a surge in COVID-19 transmission. I think we're certainly having questions related to how are we going to approach this current wave. And really, it's the same key messages. And I already sounded like a broken record earlier in the session. It's going to happen again. Those key points of ensure you're up to date with your COVID-19 vaccinations, stay home if you're sick. If you have access to a rapid antigen test and you're sick, do an initial rapid antigen test. If it's negative, don't assume that you don't have COVID-19. Repeat that test 24, preferably 48 hours later to see whether or not it has changed. I do strongly recommend, as we're seeing an increase in activity, that people wear a well-fitted, tightly fitted mask if they're attending indoor gatherings that are crowded or you're not able to maintain space and you're there for a longer period of time or more than 15 minutes essentially. And also for those folks that are at higher risk of more severe COVID-19 illness, to very seriously be considering wearing a mask for any crowded outdoor gatherings, or for individuals that might live with or work with those at higher risk for severe COVID-19 illness. I'll turn now to some updates about COVID vaccination, just because we do continue to emphasize the need to stay up to date with COVID vaccination. And as usual, we planned our session well in advance, knowing that there was going to be a provincial announcement this morning, so everything is hot off the press. So as you likely heard Dr. Morris say at his press conference, the province is expanding eligibility for second booster doses. So anyone aged 18 and over is eligible to receive their second booster dose, recommended to have been at least 5 months since their first booster dose, and a minimum of 3 months if they've had a recent COVID-19 infection. It is a bit of a nuanced, I think, policy. The province is recommending anyone aged 18 and over that has a medical condition that either moderately or severely affects their immune system to get their second booster dose. And then otherwise, they've opened up eligibility, but for those other individuals to make an informed decision based on their own risks for whether or not they choose to have a second booster dose at this point in time. What's really key with this most recent announcement this morning is to not lose sight of the importance of the first booster dose. There is still a large proportion of the community that is eligible for their first booster dose that hasn't received it. Just in HKPR jurisdiction alone, among those eligible for their first booster dose, only 59% have received it. Which means there's another 41% that haven't received their first booster dose. Certainly, as in the older age groups, we've seen better uptake, and we're close to 40% among the population age 60 and over that's already received their second booster dose in addition to their first booster dose. So, key message, if you haven't received your first booster dose, really now is the time to do it. We are seeing increased activity, and we know that the benefit of that first booster dose is important. If you're 18 and over and have moderate or severely immune compromising conditions, it's recommended you get that second booster dose now, and certainly your first booster dose if you haven't received it yet. In terms of access to vaccines, so there remain the usual channels Pharmacies throughout the region are continuing to offer COVID-19 vaccine. There's many primary care providers and primary care teams that are offering vaccine clinics to all eligible individuals. There are health unit-led clinics that are being offered, and with the recent provincial announcement, we are adding additional health unit-led clinics at the health unit offices. These additional clinics will be by appointment only, and appointments will be made available through the provincial booking system. It's our understanding that the provincial booking system will be updated to accept these additional second booster doses by tomorrow. If you're not seeing any appointments yet tomorrow, I would suggest that you keep checking if you'd like to receive your vaccine through one of the health unit-led clinics that will be upcoming in the next couple of weeks. In addition, I think we're fortunate that the GoVax bus continues to frequent our region. There are 6 GoVax bus clinics that are scheduled to come across HKPR in the next 2 weeks, and additional 16 visits from the GoVax bus scheduled for August. As of right now, it's our understanding that the GoVax clinics will continue to accept walk-ins. And so for those people that are now eligible for their second booster dose, that you should be able to walk in at a GoVax bus clinic. And if you're looking for specifics in terms of dates, times, and locations, you can visit to our website, which has all of the up-to-date information, and we'll have more information posted in the next couple of days as we confirm additional clinics. The other thing that I wanted to flag, although I don't have a concrete answer for it yet, but I'm sure people are wanting to ask about, is vaccination for those under age 5. We know that in the US, the Moderna vaccine was approved for infants aged 6 months to 5 years old, and that they've submitted their application to Health Canada. At this point in time, we're waiting for approval from Health Canada, and we're waiting for the statement from the National Advisory Committee on Immunization, which will provide some overarching guidance on its use in Canada. Once those are out, we'll receive our policy directions from the province and begin to support its rollout across the region. We are hopeful that these approvals and announcements will be soon, and I've heard potentially as early as this week, but I think we just have to be patient and wait until we see those announcements. We have been working with local primary care providers to determine how we can best support its rollout once it's been approved and when we receive vaccine in our region. And it's likely that the majority of vaccine administration for young infants will take place either at specific health unit-led clinics or primary care clinics, which really makes sense as these clinics are the ones delivering your other routine childhood immunizations and have relationships with families in providing vaccination coverage for infants and young children. So those are all of the updates I have related to COVID-19 at this point in time. I did want to highlight for everyone, or in case you had missed it, we did issue an opioid alert yesterday on our social media channels as well as a media release. I think similar to many other health unit jurisdictions in the province, HKPR has seen an increase in opioid overdose activity over the last year to 2 years. We've certainly heard many comments and statements coming out of Peterborough region, and HKPR is certainly not immune. Over the last month, we have had a report of an increased number of overdoses. This can be attributed potentially to contaminated drug supply, as well as ensuring that people have access to naloxone and are not using alone. We do have some key messages that we'd like to continue everyone to share. Continue to support everyone in sharing, which would be that for those individuals using substances, especially if they're using opioids, to use a small test amount first before a large amount in case the supply is contaminated. not to mix drugs or not to mix supply chains, again, in case the supply is contaminated. To keep naloxone on hand, so naloxone kits. Naloxone is a medication that reverses the effects of opioid on the body, so it can prevent overdose deaths. And to not use alone, to ensure so that there is somebody there to respond should, for some reason, it be an overdose from an opioid. Otherwise, I think I will end my updates there. I know folks are likely trying to enjoy the summer as best as we can. Happy to answer any questions today. So I'll hand it back to you, Bill.
Thank you, Dr. Bocking, for that update. Really good information, as always. And I guess I'm going to open it up now to questions from members of the media. It's been a few weeks, so I'll just do a refresher. If you're able to ask an initial question and follow up, and then once everybody has had a turn, then we can open it up to subsequent questions. So if you wanted to raise your hand virtually, and we can then go from there, or you can easily chat, enter a question in the chat box. So we're opening it up if you have any questions for Dr. Bocking. We've left them speechless. I thought, oh, here we go. Katrina, go ahead with your questions.
Hi, Dr. Bocking. Thank you for all the important information. Just wondering, now that we are in this 7th wave, in other waves, we've been given guidance when it comes to social gatherings and things like that from health professionals. So I'm wondering, as we are in the summer, if there is any type of that guidance that is being provided, or if you have any advice when it comes to gatherings.
So with increased COVID activity, especially if you're at higher risk of severe illness, I would suggest you start to decrease your social gatherings, especially large social gatherings. If you're able to move gatherings to outdoors, certainly, or if you are meeting indoors, you're able to open windows. In summer is the best time to be doing this. That will help to decrease the risk of transmission or spread of COVID-19. We're not expecting from the province any formal policy direction related to restrictions or limits on social gathering limits. And I think that's similar to the last wave. But at this point in time, it certainly would be appropriate to add that back on your radar in terms of the risk of COVID-19 transmission with social gatherings.
Okay, and for eligibility for the 4th dose expanding to all adults beginning tomorrow, I know you said that the focus should still be on those who haven't gotten their first booster, but if you are someone who has gotten your 3rd shot, when it comes to the 4th shot, should there be a sense of urgency to get it if you've surpassed that 5-month period, or what is your advice on those who are not eligible for the 4th dose?
So it's tricky to make a blanket statement, because certainly for those individuals age 18 and over with medical conditions that have compromised their immune system, and it's been 5 months since your last dose, it's recommended that you get that 2nd booster dose. For everyone else, really, it's that individual risk assessment. And that's going to depend on your own health status, what your risk tolerance level. It's going to depend on who you live with and who you work with in terms of their risk for severe COVID-19. And it also depends on your local context, the amount of COVID-19 transmission that there is around. There are some areas of the province right now that are seeing such an increase in transmission that, yes, it makes a lot of sense that they get their 2nd booster dose much sooner than in other areas of the province that we're not yet starting to see that increase, where there might be some time where it might make sense to wait until the fall. So it is a bit of a nuanced decision and difficult messaging, but I think it's also important to be aware of those different factors that come into play.
Okay, thank you so much.
Thanks, Katrina. I'll turn it over to Catherine with your questions.
Thank you. Good day, Dr. Bocking. So I know we're in summer break right now with the school kids, but they'll be going to summer camps and taking part in activities and whatnot for the next 8 weeks. What advice or what suggestions do you have for parents in regards to getting their children vaccinated during this time period?
Mhm. Well, I think certainly for if we break it down by age group, we have our 5 to 11-year-olds, which are probably the ones participating as campers, that we know in our region, just about 50% actually received their first 2 doses of COVID-19 vaccine. So if you're a parent wondering whether or not you should still get your child vaccinated, I would say it's still recommended that you do. We're continuing to see COVID-19 activity in the community, and although kids in that age group are at lower risk of severe illness, we do know that it can happen, and that it can also help to prevent other things such as long COVID syndrome. For those that are looking for booster doses, again, I think if it's a first booster dose, it makes sense to get vaccinated. We know that COVID-19 is not going away. We know that the vaccines do help to protect against severe illness, and that really the benefits of vaccination outweigh the potential risks. So as we look towards the fall, I think we'll certainly be, again, promoting vaccination and encouraging families that haven't participated yet to participate.
Okay, thank you very much.
Thanks, Catherine. Do we have any other questions from anybody in the audience? I don't see any questions in the chat box. We'll open it up if anybody does, even if you've asked a previous question. I'll make one last call. If not, then I appreciate everyone attending for, I see we have another hand. Nawaz, if you wanted to go ahead.
Yeah. Can you hear me?
Yes, we can.
Hello, Dr. Brocking. This is Malav. How do you do today? Just wanted to ask questions. Question regarding the vaccination for children aged 5 and below. You mentioned about it in the conference right now. So just wanted to ask that when are these vaccines going to be available for children, especially in Ontario and or Carter regions?
Mm-hmm. So good question, and I don't know the exact answer. So the first part is, when will the vaccines be approved for use? We're hopeful that we'll hear that information this week. The second part of it is, once they're approved and we've received kind of go-ahead or policy direction to offer it, the second question is, when will we receive the vaccine? And I understand that there will be some supply available really within this month, or very shortly after the vaccine is approved, there should be some vaccine available. So I don't have specific dates because we're still waiting on those announcements, but I do anticipate that it will be soon.
All right. Thank you very much.
Thank you for that question. Catherine, I saw your hand up. Do you have a follow-up question?
Oh gosh, no, I was just lazy.
Okay, okay. I'll make one final call then if anybody has any additional questions. If not, then I appreciate the media for attending. As always, we thank you for helping us spread the information. Great appreciation to Dr. Bocking for providing an update and answering questions. Just a note that our next media information session will be Wednesday, August 3rd at 2 o'clock. We are going back to the first Monday of the month, and we hope you'll join us then. In the meantime, have a great rest of the day, and thanks again for joining us.
Thanks, everyone. Take care.